Good afternoon. Thank you everyone for joining us for today's Lunch and Learn. We're discussing the impact federal cuts could have on sexual assault cases. Before I introduce our moderator and panelists, let me go over a little housekeeping information. Please remember to keep your audio muted and your videos off so that everyone can focus on the panelists. Feel free to put questions in the chat and the panelists will keep an eye on that and answer as many questions as possible. For those of you who aren't WPCTN members, we would love to have you sign up to be a part of us and our organization, and I would encourage you to look into that. We've got some great things going. You can continue to check out our website for upcoming programs and book reviews that we've got going. And for those of you obtaining CLE credit today, we will turn in that paperwork for you. All right, first let me introduce Judge Melissa Blackburn. She is a Nashville native, a graduate of David Lipscomb High School and Lipscomb University. She attended the Nashville School of Law to earn her law degree. Following graduation, she decided to practice law in general sessions courts in Tennessee and extensively in Nashville. Prior to her election, the focus of Judge Blackburn's practice was in the area of employment law, standing up for employees who face discrimination and unfair wage practices. Judge Blackburn has been a strong advocate for children, especially those who have suffered the horror of sexual abuse. In addition to her duties in General Sessions Court, Judge Blackburn serves as presiding judge of the Mental Health and Veterans Courts. She works through the court program to provide assistance to the mentally challenged and works with Nashville veterans who have encountered legal difficulties resulting from trauma suffered in the service of the United States military. We have Rachel Freeman, who is a licensed clinical social worker and the president and CEO of the Sexual Assault Center. Rachel began her career at the Sexual Assault Center in 2001 as an intern, completing her master's degree in social work. She worked as a therapist before assuming the role of clinical director, then vice president of programs, and finally as president and CEO in January of 2018. Under her leadership, the Sexual Assault Center has doubled in size in the last few years, growing to an agency of 55 staff members. In 2018, SAC added on the SAFE Clinic, Sexual Assault Forensic Exam, Middle Tennessee's first non-hospital setting for medical legal rape exams. The center now serves approximately 1,200 children, adults, and families each year, and also works to end sexual violence through training and prevention programs. And we have Kate Boston Melby. She is a 9th generation Tennessean, 3rd generation trial attorney, and dedicated advocate for survivors of sexual violence. With more than a decade of legal experience, Kate previously served as chief prosecutor for sexual violence and human trafficking and as an assistant district attorney in Davidson County, where she prosecuted violent crimes, including high-profile sexual assault and homicide cases. Currently, Kate serves as associate counsel for the Tennessee Department of Correction, specializing in contracts, grants, and procurement. Welcome to you all. Thank you for being here today. Judge Blackburn, would you like to get us started?
Yes. Both of these very talented women sent me some questions and some thoughts last night. And I'd like to start with Rachel Freeman. Can you give us a little bit of a background on what a forensic medical exam is, who is eligible, the guidelines, and the time frame, as well as the benefit of seeking an exam?
Yes. Thank you, Judge Blackburn, and thanks so much for having us today. We're excited to talk about this a little bit more with you all. Medical forensic legal exam also is referred to often as a rape kit. Rape kits are available for anyone, any person who's experienced a rape or sexual assault within a certain time frame. National best practice standards have just increased that time frame to 96 hours a couple months ago. So that's the standard that we use here at the Sexual Assault Center's Safe Clinic. So anybody who's experienced a sexual assault and is interested in getting a medical, legal, forensic exam can come into the clinic 24 hours a day, up to 96 hours past their rape or sexual assault. We strongly encourage people to get a rape exam because not only does it collect the evidence, the DNA evidence from experiencing this trauma, but it also helps make sure that individuals who've experienced this crime get the medical care and treatment that they need to make sure that they can prevent STDs, HIV, or any other medical issues that might come about after having experienced a sexual assault. This can also trigger the process of getting wraparound services like counseling, advocacy, and engaging with the criminal justice process. You do not have to report to law enforcement if you want to get a rape exam, even though we hope at some point people want to engage in the criminal justice process so that we can stop the perpetrators from doing this. We also completely understand that this must be done at the victim's timeframe, at their pace, and when and if they are ready to do it. But the first and foremost thing we always encourage is for anybody to get that exam because that starts the whole process, and you can file an anonymous kit or you can do it with with your identification. So lots of reasons to get one.
How are the exams paid for and what is the cost?
There is never any cost to a victim to get a rape exam. It's actually against federal legislation for anybody to be charged for a rape exam. There are some situations where somebody might go to the hospital and get a rape exam, and if there are other injuries, the victim would be charged for the medical care from the other injuries. But as far as a rape exam goes, there's never any charge. The state reimburses up to $1,000 for every rape exam provided to the clinic or the hospital that does the exam. For example, when SAC does an exam, we then submit for reimbursement to the Victims Injury Compensation Fund of the state, and we typically get close to $1,000, but it costs us on average around $1,500 to $1,800 to provide every exam. So nonprofits like SAC are then required to fundraise to make up for the additional expenses incurred. And Kate, you probably have more to say about that too.
About the cost of them? Well, I don't know who, like what department, I guess, pays for them within the state. But I mean, yeah, like you said, they're all free to victims everywhere, and they should never have to pay for anything. And then if they do have to pay for any of the additional treatment and then they report it, they can always file for victims compensation with the state through the DA's office.
Is there current legislation that's impacting the rape exams in our state, ladies?
Yes, there is. And ironically, I'm on a text chain right now. There's a bill being heard today about rape kit access for minors and their ability to seek exams without parental consent, because so often we know that sexual assault and rape happen by somebody known to the victim, oftentimes within the victim's circle of trust, and many times within the household or by a family member. So we're trying to clarify through legislation that a minor victim can still seek that medical care and medical treatment without parental consent when there is a situation that prevents the teen from telling or disclosing to their family for a certain reason. So that's one piece of legislation very active right now, but other things that have gone through the legislative process in regards to rape exams include in 2022, we passed a bill that created a tracking system for rape exams. So you all know when you order something on Amazon, you can track it at any given point in time. This was not the case for rape exams. Somebody could come into the clinic or to the hospital and have an exam, and then at any given point in time, they had no idea where their kit was in the process. And that could be for months to years where they didn't know where their kit was in the process. This tracking system created a way for a victim to get the exam done. They're given an identifier, and at any given point in time, they can track their own kit and know where it is, whether it had been submitted to law enforcement, whether it was being tested, whether it was sitting somewhere waiting to be tested, whether it was with the DA's office. So that tracking system has been a tremendous change in our state for rape victims and rape survivors.
I'm sure that gives them a lot more confidence and a lot more comfort by being able to know where it is.
Just knowing where it is does have a lot of positive impact for people, because prior to that point, they would call law enforcement on a regular basis, just trying to figure out where it was, or their victim witness coordinator, just trying to figure out what was going on with their kid. This allows them to know that. And it also increases accountability for every other professional involved in the case. What we hope at some point is that there will be a timeline put on the tracking or the testing of rape kits. It's quite a tedious process to become trained to be able to test the DNA kits. And we think that those tests should be able to be done within a certain amount of time, so that victims don't have to wait 18 months to 2 years to have their kits tested. But that is still something that's a work in progress in our state.
Thank you. One of the other questions that was submitted is, how does a reduction in victim advocacy funding affect the prosecution of sexual assault cases in Tennessee? That's for both of you ladies.
I can start with this one, I guess. I think part of it is the overall view of when victims see funding has been cut for things like this, then they start thinking, okay, well, maybe this doesn't matter. Maybe I shouldn't report. Maybe nobody cares anymore. And we've actually seen, at least at Vanderbilt, and I talked to the seniors at Vanderbilt, said this is something they're seeing nationally since January, a huge decrease in people coming to get MLEs at Vanderbilt. There is no, we don't have a reason, but I think some people, there's things that you could speculate on, I think. But part of it, I think, is when you know that things are being cut, you know that costs are being taken away from, or funding is being taken away from things like victim services, then you may have, victim advocate positions that are eliminated. You may have we have volunteers at the Sexual Assault Center that will go, advocates that will go and meet the victims during their exams. And if they lose funding, maybe they won't have someone there to meet with those victims to make them feel comfortable, to kind of help them through that process. You may have fewer expert witnesses. When you have certain cuts, of course, maybe you have someone who was a nurse and their position was federally funded by a grant or something, and then they leave. Getting them to come back to court and testify after they're in a new job or move to a different state, like that can be tricky. And so I think that it kind of trickles down in ways that some people may not expect.
What kind of funding do you think has been removed from Vanderbilt that's causing less people to go there to be tested?
I don't think it's funding that has been removed from Vanderbilt. I think it's just in general. I think just from people that I've worked with, women in general, and it's not just women, obviously, that go get the rape kits, but people in general, I think, can tell when society in general supports them and they feel protected and they feel safe. And I think sometimes when you hear in the news, all these victim services have been cut and this is happening to it just kind of discourages people from thinking that maybe their voice is going to be heard, or that people care, that they're safe or protected.
And there's a lot of conversation right now about cuts to VOCA funding, and VOCA is Victims of Crime Act funding. It's federal money that's passed through at the state level. And the state has not released what VOCA funding awards will be yet. So there are agencies like the Sexual Assault Center and other rape crisis centers across the state that don't know yet what to expect from their federal funding awards. The latest information we've heard is that cuts could be as high as 10 to 40%. And like Kate said, when there are potential cuts to victim services, it often causes more fear for victims in coming forward because they're curious about whether or not they will have to incur the financial burden of that. Right now, again, rape exams can never be a fee passed on to the victim, but counseling, advocacy, all those other services are free of charge at the Sexual Assault Center. And I think people just naturally wonder what will happen if federal funding cuts come. And sexual assault victims are often already so concerned and nervous about coming forward to disclose a sexual assault. And if there's additional financial worry behind that, then we're going to see fewer people come forward. And then the other just very logical thing that can happen is that fewer people are able to be served if there's less money to be able to provide the services.
Do you have any idea when you will get information from the state as to how much that cut will be?
Normally, we find out by the middle of March, so I'm hoping any day now. One positive in the midst of all the uncertainty is that our state, the state of Tennessee, has never had a line item in the state's budget for victim services. And victim service providers have been advocating since the fall to the governor to put in his budget a line item for victim services. And for the first time ever, we finally have seen that the governor is going to put money in his supplemental budget, and it just passed through the House and Senate last week. So there is now $20 million over the course of 2 years being dedicated to victim services through the state's budget. But that includes sexual assault services, domestic violence, human trafficking, elder abuse, child abuse, all child advocacy centers. So the money will be divvied out across all of these disciplines. The shortfall was, they were expecting a shortfall of about 25 million annually, and the request was that the state gap fill that so that they would put in 25 million annually. And while we're super excited that we finally have a line item in the budget for victim services, it isn't quite what was requested. So there's still just a lot of work that has to be done to maintain. And again, that word is very important to me, just to maintain the services that our state is providing right now. So it's a tricky time, very uncertain.
But to actually get the legislator to put a line item of 20 million is a huge positive.
Huge.
To get them to
It's a
give up
huge
anything.
Right. It's huge, huge, huge. So we feel that that was a big win for victim services. It feels like a huge progress, a big step in the right direction. And when the administration turns over after these next 2 years, we'll just have to keep this conversation going. And hopefully that having something in there will help the ability for it to grow more.
Absolutely. Well, the next question I have, and I have no idea what this word means, so if I misspeak it. What role do SANE, S-A-N-E, nurses and medical professionals play, and how would reduced funding to their programs impact evidence collection in Nashville?
Do you want me to take that, Rachel, or do you want to?
Go for it, Kate.
Okay, so a SANE is a sexual assault nurse examiner. That's what we typically call them, but they're kind of starting to go towards the term of forensic nurse or forensic medical examiner, because they are starting to do more exams than just what we would consider the rape kit, which was the sexual assault kit. In Nashville, even, I know that they are starting to swab the necks of people who say that they have been strangled, and they can test for the DNA to see if there's DNA on someone's neck. And I actually had, before I left the DA's office, a case came back where there was in fact DNA on someone's neck, which was a really powerful point for our prosecution because the defendant had maintained the entire time like he had never touched her, he'd never touched her neck, and then lo and behold, we have his DNA like right there on her neck where she said she was strangled. So that's one of the reasons why they're kind of shifting a little bit to forensic nurse examiners, just so people realize that it encompasses more than just the sexual assaults. But they are, we have them obviously at the Sexual Assault Center. Vanderbilt has them, General Hospital. Does St. Thomas have?
Off and on,
Yeah.
not consistently.
And we're lucky in Nashville, some of the rural communities, they don't have anybody, or they'll have somebody who will drive, one SANE nurse that will drive around to all the different counties. And so we get really spoiled, I think, here having so many options for people. You can tell them you can go to the Sexual Assault Center, you can go to Vanderbilt, you can tell a patrol officer and they can take you to a hospital. But obviously if funding were to be cut, then, I mean, you could lose staffing, or like I said, you may lose nurses who could find a better paying job in a different field. And so they move to a different state or they move into a different field. And it is such a specific job. And you also just need a specific person, I think, to do a job like that. Someone that is very, not that all nurses aren't, but just very open, very patient, very kind. And someone, who doesn't make the patient feel that they're being judged or that they're the person being accused of anything. But I think that you may have fewer SANE nurses that are on call, fewer trained replacements, and then longer delays in service. And so, you hear about people who go for a kit and then they have to wait 7 hours for an exam, so then they decide to leave. Like I said before, I think it just all kind of trickles down the line.
And it's so important that it is a SANE, a sexual assault nurse examiner that does the exam, because the collection of evidence is just hugely important for any potential of prosecution. And if it's not a trained SANE, if it's not somebody who's done several of these exams or who's not familiar with this type of work, then it's easy to poke holes in that. And it's very similar to if you are going to a medical professional because you've got some concerns about your heart, you're going to go see a cardiologist as opposed to a general practitioner. And the same is true for sexual assault. You want somebody who is trained and certified and experienced in responding to sexual assault cases to help you, and not just a general ER physician. That can be done if there are no other options, but we always encourage people to make sure that there are SANEs, and that requires funding. The amount of funding, the amount of money that nurses have to put forth to become SANE trained, and the amount of time that they have to put in, some hospitals will pay for that and some don't. So sometimes a SANE is becoming certified just on their own dime and on their own time. And as federal funding diminishes, that's something that we're probably going to see fewer and fewer people able to get that certification.
Rachel, will you talk a little bit of the evidence collection? Made me think about it, of all of the things that you have in place at the clinic to preserve evidence, to make sure that the chain of custody is preserved and make sure that the integrity of everything is kept in place.
Yeah, it's so important to us that we do that. When we built the clinic back in 2018, the first thing that we focused on was making sure we provided a very warm and nurturing environment for survivors to come into. We wanted it to be different than a hospital setting. Nobody should have to sit in a cold ER waiting room after experiencing the sexual assault and just be triaged with every other emergency. So we built this, for lack of better words, a spa-like environment. And when we built the clinic, people who would come through and tour the space were always blown away by the compassionate, loving place that we were able to provide. But when the DA's office came through, they were most excited about the evidence collection space that we had. There are, I think, 3 locked doors prior to even getting to the evidence storage collection room. And then once you get into the evidence storage collection room, every cabinet has a certain way that it's got to be locked and stored. And then there's a camera in the room so that if these cases go to court and anybody were to question the integrity of the evidence collection process, we would be able to show that we've kept everything as well as possible. And Kate, you saw firsthand, and so if there's anything else about that I've missed that you want to throw in.
No, I mean, it was just, it to tour the entire clinic was just kind of remarkable to me. All of the steps that were taken to ensure that, that the victim was as comfortable as possible, all of the steps to make sure that they were safe, all of the clothes that you had there so that they didn't have to wear the same clothes home if they didn't want to. I mean, in addition to obviously the evidence collection, just the entire clinic itself is just incredible.
Thank you.
Well, as a judge, I'll have to say the evidence collection piece that you're talking about, excuse me, the neck, that is amazing to me because I hear about these strangulations and I hear about other things, and I don't even do domestic cases, but I hear about them in other cases, and thinking about someone having the insight to do that makes a huge difference to me. And knowing that that evidence is being preserved and someone had the thought and foresight to do that. Because
Exactly.
I hear about them in preliminary hearings, and you want to know that that best possible case is being put forward. If someone is guilty of that crime, that we are able to put that person in, put that case forward if that person is guilty. If they're not, they don't need to be there. But if they
Right.
really did strangle that woman or that man, then that case needs to go forward.
Right. And of course, I mean, you have cases where they're like, well, of course my DNA is on her neck. I lived with her or whatever. But in this particular case, he had given an interview, and in his interview, he was like, I never touched her. I definitely never touched her neck. And so while they could still argue that at trial if they wanted to, it just makes the state's case so much more compelling. And I always would tell our detectives to treat these not the exams, but to treat their investigations like a homicide. Because I think far too often you have the victims, and I say victims, I mean victim survivor, the changes or the term can be interchangeable, but for law enforcement, we use the term victim. But I don't mean that to be offensive to anybody, but they would put so much on them to be like, well, they can tell their story, they can testify, they can say this. And it's like, well, yeah, but how much more impactful is that going to be when a jury sees, she said this happened in a room with yellow wallpaper, and lo and behold, you went to the suspect's house and the room has yellow wallpaper, or she, just things that corroborate their story all the way through. Just those little things just really help, I think, with prosecuting the case. And so I saw, as I was there for the past, I guess 2 years, it was, the detectives just get so much more involved and just be more confident and kind of excited in a weird, in a way of, okay, we are going to collect this evidence. We are going to call ID out to the scene to take these pictures. We are going to get these swabs. We're going to do this. And, we're actually going to work these up really, really, really well. And one of the examples is that case and that was all Vanderbilt. That was great.
Well, and I don't
I
know
want to
that,
reiterate.
but my husband that I've been married to for 25 years never puts his hands around my neck. That is just not something he does. He may zip my zipper up, but he doesn't put his hands around my neck to zip up my dress. That's just not something husbands usually do.
Mm-hmm.
I want to mention and just kind of reiterate what Kate said. Prior to February 2023, Nashville did not have a sexual assault DA. So Kate changed the trajectory for sexual assault cases in our community. And that's just recently. A city the size of Nashville, a city as progressive as Nashville, we did not have a dedicated sexual assault ADA. And because we started looking at these cases differently, and we moved away from just he said, she said mentality, or putting all of the burden on the victim to continuously share their story, and started looking at these cases as real crime situations, we started seeing not only more people come forward, more reports being made, and cases finally moving through the criminal justice process. The clinic has been open since 2018. Now, Nashville's been doing rape exams for much longer than that, but there was only one hospital that you could get an exam and you had to know where to go. We were not doing the number of exams in our city that we should be doing until we started collaborating and really operating from a multidisciplinary perspective. And when that started, we finally started seeing some change. Prior to that, I could count on one hand the number of cases that have come through the clinic that would ever see a day in court. And having this multidisciplinary approach, working so closely with the DA's office, has changed that. In addition to that, national numbers show that about 30% of rape victims ever report to law enforcement. It is such an underreported crime, but here in Nashville at the SAFE Clinic, 72% reported to law enforcement this last year. So 72% of the people who came in and got a rape exam at the SAFE Clinic reported to law enforcement because of the partnership that we have with law enforcement and the DA's office. And I think that's something that we really should be proud of. We still have a lot of work left to do, but we've made significant progress in these last couple of years. And I credit Kate for a lot of that.
It's everybody. It's a village.
That's wonderful. Well, I have a question. How, Rachel, do people find out about the clinic victims?
Great question. So we're open 24/7, and most people find out about our services because they Google, what do I do if I've been raped or assaulted in Nashville? And we put a lot of money and effort into having our search engine, whatever, I don't know the computer language or lingo, but to be top of the list for when people search. We also make sure that we always have a warm body in the clinic, a warm advocate who can respond, so that it's not just somebody showing up and calling a number and then we show up afterwards. There's always somebody available. So most people come in because they've Googled, what do I do if this has happened? The second highest way people find out about us is they call law enforcement. So after experiencing a sexual assault downtown, for example, they call 911 and a patrol officer or sex crimes detective responds and brings them to the clinic. Word of mouth. I know that's a weird thing to say in regards to the topic we're talking about, but we know that sexual assault is extremely prevalent, and unfortunately it happens way too often to too many people. There's no way any of us have not been impacted by sexual violence, whether personally or we hear about it from friends, family members, or just simply on the media every day. So when somebody has experienced something like this and they've had a good experience, they share that with other people when they disclose. And the more we talk about this, the more we pass it on. There are a ton of referral sources, just other community partners. We often will try and do PSAs, community-wide PSAs, so that more and more people find out. We want people to know about us before they need us. Once you need us, it can often be too late, but that requires marketing dollars that sometimes nonprofits don't have. So there's always more that we can and should be doing, but those are some of the main ways people find out about us.
Well, and one thing I want everyone on this call to know that I think is so important is the advocates at the Sexual Assault Center are completely independent of law enforcement. They are there solely to support the victim. So they aren't there to, persuade them to report, or they are literally just in their corner there to support them, which I think is such a wonderful tool to, again, have people feel seen and to feel safe, and to not feel pressured into anything. But because of that, then they can develop that trust and tell them, like, hey, the DA's office has a dedicated sexual assault team now, and now it's Macy Pesavento who's heading that. And so it's a woman who would be talking to you. You can always talk to her and then change your mind later. But it's just having that separate, independent advocate, I think, is just such a wonderful tool for people who come to the Sexual Assault Center.
There was a program that you started, I think it was before the holidays last year. It may have been the year before, involving the bars downtown. Can you tell me about that program?
Sure. It's one of my favorite things to share about Safe Bar. That's a program that we started here at the Sexual Assault Center a few years ago, but it's really picked up a ton of energy in the last year or so. Safe Bar came about because after we opened the clinic and people were coming in to get rape exams after having been assaulted at a bar or downtown or involving nightlife, there's a huge correlation between sexual assault and alcohol, but we know the solution is not to take away alcohol. It's to make sure that we try and deal with perpetrators first and foremost, but to equip bartenders with the tools they need to intervene safely. So Safe Bar is a training that we provide to bartenders, restaurant staff, anywhere that's an alcohol serving venue. The bars and restaurants get trained. At least 50% of their front of house staff have to be trained for them to be considered a safe bar. And then we follow up every few months to make sure that when there's turnover, those people get trained. But the people who get trained have a greater ability to respond if they see something that's unsafe or questionable. Along with the training, we provide coasters that have drug detecting strips on them. So if you were worried that a drink had been tampered with, you would drop a drop of your drink on this testing strip and it would turn a certain color if it had been tampered with. And then there are also signs in the bathroom that talk about what to do if you feel unsafe. You can order an angel shot or an angel beer. It depends on what the venue is, what the name is. And the bartender knows what to do if you were to go up and say, I would like an angel shot. And we do kind of consumer test that. So we've had people go into bars and order that to make sure that people know how to respond and have what they need to still be a safe bar. So that's a program that has been very exciting. And if you know any bars or restaurants that you frequent that you think should be a safe bar, feel free to let me know and we can reach out to them.
Great. That's great for tourists.
Mm-hmm. Yes, sadly, it's needed. And we didn't say at the very beginning of this, but obviously Kate and I and Judge Blackburn, I mean, we talk about sexual assault a lot. This is something that we deal with in our everyday world, but it's not lost on me that this is a very difficult topic. And just being here and listening to us talk about this, I know sometimes it can be very hard, but it's so important that we talk about this more and more because that's how we take away the power and control from perpetrators. All of us are first responders and all of us, again, know somebody who has been impacted by this. And the more we can respond in a positive way to those who've been impacted, the greater chance we're going to see a decrease in the negative long-term effects. The best prognosis for healing is to be believed and supported. And we can all do that. And that's what Kate and I have tried to do collectively within our field, is to make sure that people can feel believed and supported and to get the care and support they need. When you have access to long-term support, the likelihood of negative long-term side effects will decrease. If not, if people don't get the help they need, they turn to drugs or alcohol or suicidal ideations or eating disorders, things that negatively impact individuals, their families, and society as a whole. So if we can collectively work towards a stronger coordinated community response to rape and sexual assault, we will see the impact decrease.
Well, and I want to touch on that briefly, is you'll see in the news, I mean, I don't know what the numbers are for this year, but the Nashville numbers for reported sexual assaults last year was up like 30%. I don't know, it was up quite a bit. And I was actually thrilled by that because to me, that doesn't mean that they're happening more often. It's like what Rachel said earlier, that it's just such an underreported crime. To me, I saw that as they feel more comfortable to come forward. They feel more comfortable to get the kit. They feel more comfortable, like someone's going to believe them. Someone's going to take them seriously. It's not going to be just quote, he said, she said, which is one of the, I hate that phrase. But that was kind of promising to me because I think that where some people may see, oh, well, it's happening more often. It's not like crime like murder. You know, it's something that the victim has to come forward and report themselves. And that I think they can feel the support that we've tried to create.
Well, and one thing unfortunately, the victims that I dealt with of sexual assault were children, and they were being assaulted by their peers. And what was so sad is the perpetrator was the first victim. They learned their behavior because they had been a victim. So you're talking about a first grader that was a victim of sexual assault, assaulting other first graders. And that is just so sad, because that child has learned that behavior at such a young age and is repeating that behavior already. And to try to get help for that first poor child that is so sick already at such a young age is so sad and so disheartening. And we have to do that when we find out about those things. And it's just something that they desperately need.
Yeah, I wish these services weren't needed. I wish that there was a way that we could put ourselves out of business because we're not needed anymore. But you're right. It happens to young children. It happens to adults. It happens to elderly individuals. And it's a crime that is still difficult to talk about in our community. It's taboo. It creates shame and fear and concerns. And we have to keep working to change that so that a young first grader can get the help that they need and don't have to carry that around forever and then take on some of the negative behaviors themselves. If we can start intervening at a younger age, and sometimes that simply means being brave enough to have difficult conversations as parents, as adults, as caregivers, as professionals in a child's life, so that we can change the course of healing.
And it takes a village. It really does. It takes everyone to be aware of what's happening in everyone's life, because you see the negative behavior, and that's the first warning sign, because then you realize something's terribly wrong and you're trying to figure out what that terribly wrong thing is and trying to help someone.
Well, and one thing that I want to, again, plug the Sexual Assault Center a little bit, is they not only provide therapy for the victim, but anybody in the victim's family that needs it. So say the mom of a victim is having a really hard time knowing that this happened to their daughter or their son, they too can go and see a therapist there. And I've had so many family members that I've told about that service, who I think have taken advantage of that, just knowing that there's something for them too, because it doesn't just affect the person it happens to, it affects anyone who can care about them.
That's important, because that's something I saw with the parents of the children that we dealt with, both my husband and myself. The parents were just absolutely horrified and didn't know what to do and didn't know how to deal with it or how to fix their children.
Or sometimes, I've had parents who were triggered by it. Maybe they have their own sexual assault in their past that they had never reported, or completely unrelated, but because of what happened to their child, they have now been triggered with those old memories. And so I think that, again, we're just so lucky to have the Sexual Assault Center here in Nashville.
There's no question. Well, ladies, what legislation do you see or hope is on the horizon that will help?
Rachel, tell them about the one from last year.
Start one?
Hmm?
Oh, Danielle's Law. Yes. Okay. So one of the things we're super excited about is Danielle's Law. There was, up until last year, if you wanted to report a sexual assault as an adult, you had a year to be able to file a civil suit. Kate, am I saying this right?
Yeah.
And
yeah.
that
So
is,
it's like under the personal injury theory. So it's kind of like the same as a car wreck or something.
yes. So you have a year to report. Now, in the trauma world, we know that sometimes it takes people a long time to be ready to disclose their abuse. So sometimes, typically people go the criminal justice route first, and that is often going to take much more than a year. So victims of sexual assault were missing this window of opportunity to file a civil suit. So we took that to the legislature and we ended up passing what's called Danielle's Law, and that is named after a woman who who missed the statute of limitation, and she decided to try and give back in a way to help other people. And this was extremely empowering to her. But now, if an adult victim of sexual assault wants to file a civil suit, they can do so up to 3 to 5 years after reporting. So 3 years if they don't report to law enforcement, 5 years if they do report to law enforcement. And that is going to be extremely positively impactful for sexual assault survivors moving forward. And I have to say, this came about because when this particular victim survivor was sharing her story with us, and we realized there just wasn't any, unfortunately, there wasn't anything else that we could do to change the course for her. We talked to Kate, and Kate said, well, we could change the law. So we joined together and worked to change the law, and the law is now changed. And I think that's an excellent example of how you can move from a micro to a macro level and make positive change. So we're really excited about that one, very proud of that. One of the things I mentioned briefly earlier, we would love to see a timeline put on when rape kits have to be tested by. Everybody's aware that there's been a national problem with backlog of rape kits. I know Shelby County had a tremendous backlog problem several years ago. Nashville has some improvement, some room for growth and improvement in this area as well. And there are a lot of barriers, a lot of them leading back to money as to why it takes so long for a rape kit to be tested. But if we can put timelines, for example, 60 days or 90 days around the requirement for tests to be tested, then we're going to be able to catch situations where offenders offend multiple times and will decrease the recurrence. There was a very, very sad situation in Memphis where a woman was assaulted and murdered. And I think it was the day after this happened, or it was definitely within the week, the rape kit of another victim who had the same offender, their rape kit was tested, and it had been sitting there for over 18 months. And had that kit been tested sooner, then this woman would probably not have been killed. So there are a lot of reasons as to why a timeline for testing rape kits is super important. Most offenders offend multiple times before they are ever caught. And if we can test more kits and hold offenders accountable, then we're going to see fewer victims. So that's the biggest thing on our radar right now.
And to kind of piggyback on that, with the case from Memphis, Cleotha Washington was the offender, but the first, and not to take away from rape kits being tested, the timeline is like super important. But one thing that I also tried to change the mindset of our detectives that I think they did was, in that first case in Memphis, like, she knew who it was that had raped her. She was just, they didn't have the rape kit back to quote confirm it, or have his DNA or whatever. And so whenever I would review cases, if the person knew who it was, instead of just saying, okay, well, we can't do anything until we get this kit back, it's like, that's where the corroboration comes in. Well, what else is there to corroborate what they said? We don't have to wait every time to get that kit back just to prosecute if they already know who it is. And so again, it's super important to have it. And of course you need it for a trial. And a lot of times if they don't know who it is, then yes, you're going to get that code set, and that's super important. But that was something that I was proud of, was our detectives kind of changing their mindset of, okay, well, we don't have the rape kit, so we're just going to stick it on the shelf for however many months until it comes back, instead of let's do the investigation with what we have and try to go forward as if that doesn't exist. But if we had them turn around quicker, then that would be very helpful.
There was a question about immigrants reporting, and do we feel like this is going with ICE and their issues? Is that going to make people hesitant? Well, my thought on that, and what I've already seen, is based on the current administration and what their push. We're concerned in the courthouse about victims not being willing to come testify. We're concerned about witnesses not being willing to come testify because ICE is in the courthouse and they're just hanging out. And we're concerned about family members, anyone in the courthouse that doesn't have to be in the courthouse is possibly putting themselves at risk right now. So all those other people that would be there, that support unit, whatever they are, whether it's a witness, whether it's a family member, that has an effect. They are at risk and putting themselves at risk coming into the courthouse at this point. So that is a concern. And if someone is a victim and is an immigrant, they are putting themselves at risk by reporting it, even though they are a victim, because that is going to put their name and their information in the system, unfortunately.
Well, and a lot of times you would get defense attorneys saying, well, they just wanted a U visa. They're just doing this to get a U visa, which a U visa is something that a victim of crime can get to allow them to stay in the United States. There's also a T visa for trafficking victims, but that process takes years and years. And out of the hundreds of thousands of applicants they get, they may grant 10,000 or less. And so you would hear that a lot, but it's like, that's not rooted very well in reality, I don't think. But you also have not only victims who are worried about themselves getting deported, but sometimes they're worried about their abuser being deported as well. Maybe they want something, they want a reporter, but they don't necessarily want that person to be deported. And so you'll see people that won't come forward sometimes because of that fear as well.
Yeah, this is going to have a very harsh negative impact on the immigrant community. We already know that marginalized communities are often at greater risk of crimes like sexual abuse and disclose and report less often than other groups. So we're just going to see that continue to, that disparity continue to rise. And even though centers like ours don't ask for legal status, that's not a requirement of being served. There's still just an intense fear around, well, what if ICE shows up here? Or what if it goes, we can provide the counseling and the support in the aftermath, but the likelihood that somebody worried about ICE is going to follow the steps to move forward in the criminal justice process is just continuing to decline. Sorry, Kate.
No, you're good. I think the hospitals are required now to ask that and to report that, which is Katrina Brown and I've talked about it in the past, and I can't remember what they ended up deciding. But I actually, again, before I left, had a case where a man targeted people that he knew were undocumented and would go on a Tinder date with them or something and would rape them. And that was kind of his MO, was because he knew that they most likely would not report. And it wasn't until one of them finally came forward and then he was in the news that some of the other ones, I guess, felt comfortable enough to report. But that, again, was before some of these changes have taken place. That was last year. But you also see that. You see people who are literally targeting people because they think, okay, well, they're not going to report.
And that's so sad.
So, Melissa, can I do one follow-up question here? I'm sorry, Judge Liburd. So with the rape kit, if it takes 18 months, let's say the 18-month one, does your timeline for being able to prosecute, for the victim to want to go forward begin then, or from the date that it happened?
So the statute of limitations would be, but for rape, there's really no statute of limitations in Tennessee. You can kind of prosecute whenever. But for the civil cases, that's one of the reasons why it was so important to change the law, is because it is from the date it happened. And so you might have a rape kit where you're waiting on it to come back 18 months. And by that point, the statute of limitations had run out. And the reason that the civil law is so important to me is because there's a lower burden in civil cases than there is in criminal cases. So while I may review a case and be like, okay, we won't be able to get beyond a reasonable doubt because it's such a high burden in this case, they may be able to get some sort of relief or something in a civil lawsuit. But it is from the date that the event happens.
Okay. Judge Blackburn, I cannot say thank you enough for moderating today, and to Rachel and Kate. One last question, unless Judge Blackburn has anything else, but this may be a question for Judge Blackburn also, is how can we help? How can we as individuals help?
I think that's a question for Rachel.
Oh, it's a big question. It's a great question. I think one of the first things I always like to encourage people to do is to talk about this as much as possible, share the resources of places like the Sexual Assault Center so that when people need them, they know they're here. We're not just here to provide care in the aftermath of victimization. We're really looking to prevent sexual assault too. And that takes all of us, from having conversations at schools with parent associations, with staff, with faculty, with guidance counselors, people within church and religious settings, making sure that anybody anywhere has the policies they need, the procedures, the steps, the tools within their own personal toolkit to be able to respond and protect anybody from sexual violence. Because again, we're all first responders. So being able to talk about this and spread awareness is one of the best things. Engaging with us from a legislative standpoint, we have a legislative action committee. We actually put out an urgent call to action this morning. Call your legislators, ask them to support this particular bill. So if you're interested in that, feel free to reach out to me or go to our website and sign up to be on that. We have April is actually Sexual Assault Awareness Month. So this is a great time to be able to have this conversation. We have an awareness breakfast on Thursday. So if anybody's interested in attending that, I'm happy to give you that information, or you can find it on our website. It's actually a panel conversation with Benton McDonough, who is our night mayor, and Chief Drake, our chief of police, and me about the state of sexual assault in our community. So that should be hopefully interesting and informative. Great way to start your morning, maybe. So different things like that, just engaging with us in different ways and making sure that anybody who who might need our services can access them. We've got a 24-hour crisis line. We talked a lot about the Safe Clinic, which is a way people come in when they've just recently experienced a sexual assault. But most of the people we work with in our counseling department were survivors of childhood sexual abuse. So they might have held on to this secret for weeks, months, decades. So we make sure we provide care to anybody who's been impacted by sexual violence, no matter how long ago that was. So, thank you.
And I noticed that Warwick Robinson is on here. I'm going to give him a little shout out. He had a client that has ties to some of the bars downtown, and I just happened to see him one day in the elevator, and I was like, you know what, your client should really do the Safe Bar program and to get other people to do it as well. And Rachel, how many did we have before? Or I say we because I'm like obsessed with it too, but how many did you have before that? And then how many did you have like before last summer, I'd say, and then after last summer?
We had under 20, and now we have about 44 bars on Broadway. So that was a huge positive peer pressure situation that Kate and Warwick helped us with. I think it's easier for the bars on Broadway to know that their neighbor is also doing this. And we try really hard. It's hard for me to pick up the phone and call and say, hey, Tootsies, do you want this program? I'm calling from the Sexual Assault Center. But if you call as somebody who knows the owner or bartender or is a patron, they're much more likely to respond in a positive way. And this is a program that you want before something happens. It doesn't mean that there's a problem in your bar. You want it from a preventative standpoint. So that's a great way. Kate, thank you. And Warwick is a perfect example of how you can engage and help us meet our mission by just opening doors and making connections and helping us stop this crime and make Nashville a safer place to be.
Well, and just again, raising the awareness of it and letting people know that, yes, it is an actual problem in Nashville, but it's not a problem that people need to be ashamed of or that we can't talk about or that it's going to be like whispered about in a corner. You know, it's something that as a community, we acknowledge that it happens. And, you know, we believe people when they say that it happened to them.
Yeah, we believe you, we support you, and we're here to help.
I know there are two more questions. We're a couple minutes over, but can you all see the chat bar if you can answer it real quickly?
The DNA evidence recovered by detective and crime scene, yeah, I mean, that takes a long time too. It's just that you don't see as many cases that are waiting on that to get charged the same way that you used to with a rape, or that you might still with a rape in some circumstances. And so the crime lab has you can ask for something to be priority if it's going to trial in the next month or whatever. And so they only have so many people that can test things, and then they can outsource things. But I would say, yes, there are delays, but it's different because you don't have cases that aren't going forward, or people that aren't necessarily found or figured out or whatever until that is processed, if that makes sense.
And there's one other question in there about an advocate confidentiality bill. We worked on that bill for 3 years. It finally passed last legislative session. It seemed like possibly one of the easiest bills that we could ever work on, and it proved to be one that took the longest. But that simply provides the same level of protection for an advocate that a counselor or a medical professional or a legal person might have when a victim shares their story with an advocate. The advocates are now protected from and don't have to risk having to share that information within a court setting. So that did pass, and we're very glad for that, because it makes people feel more comfortable to be able to disclose fully to their advocate.
Thank you. On behalf of the Women's Political Collaborative, thank you. Thank you, Judge Blackburn. Thank you, Rachel. Thank you, Kate, for doing this. And as a reminder to everyone, we will turn in, for those that are doing CLE, we will turn it in for you. And just watch our website. I plan on reaching back out to Rachel to say, how soon do we want to do another one of these? So again, thank you all, and everybody have a great day.
Thank you.
Thank y'all.
Bye-bye.
Thank you.